Morning. Good.
Today I'm going to talk about a little bit about Medicare and kind of make things a little more simpler. This is for a general presentation, a longer presentation. I'm just kind of doing a Kevin Henderson and chopping it up a little bit to work on, if you will. So what I'm going to talk about today is when you are eligible, and I'm going to talk about some of the advantages and disadvantages of parts A, B, and C, and possibly D if we have a little bit of time left for that. So let's jump into it. And when are you eligible for Medicare? Age 65 is pretty much the date when you are eligible for it. If you are under 65, you can't get Medicare if you are disabled, and there are special situations which Medicare will allow that to happen. You have to be a U.S. citizen or a legal resident and live in the U.S. For the 5 consecutive years. Sometimes there's a little there's not a lot of clarity with Social Security and Medicare when they put together. It doesn't matter whether you're on Social Security or not on Social Security yet. Your age and date for Medicare is 65. So Social Security does not play a factor in your eligibility date for Medicare. There are a couple different types, a couple different ways you can get Medicare. And Medicare A and B is the first one I'm going to talk about. And that's provided by the government and government subcontractors, where Medicare pays fees for the care you receive directly to the hospitals and doctors when you go get your health care from them. The second way is Medicare Advantage in Part C. This is called Part C. This is another monster, another beast that I want to talk about, probably another 8 to 10 minute speech on this later on. But it is provided by private companies that are approved by Medicare, and examples of this would be United Healthcare, Coventry, or Humana. And what happens is Medicare pays a fixed fee to the plans or to the companies, and then the company or the plan pays the doctors and hospitals for your care. So, talk about what Medicare A is and what it means. Is Part A helps with hospital costs and skilled nursing services after a hospital stay and some other skilled care. Some of the advantages of Part A is that most people don't pay a premium for Part A, and you only have to pay a deductible for a hospital stay less than 60 days. You can go to any qualified hospital that accepts new Medicare patients, so it's accepted through the U.S. And the enrollment is fairly easily, and there is no qualifications on pre-existing conditions or medical history. So it doesn't matter what your previous history is, you can still qualify for Part A. Some of the disadvantages of Part A is that long hospitalizations can be fairly expensive, because after 60 days there's a copayment per day on that. So if you're in the hospital for 3 or 4 months, it can be extremely expensive. Multiple stays may mean multiple deductibles. And what that means is that if you're in the hospital 5 different times throughout the year, and say your deductible is $1,000, you could rack up around $5,000 in deductibles that you'd have to pay out of pocket throughout the year. Hospital care outside the U.S. Is generally not covered. Now moving on to Part B. Part B helps with the cost of doctor visits and other medical services that do not require an inpatient hospital stay. Some of the advantages of Part B is that it works the same way throughout the U.S. You receive care from any participating physician that accepts new Medicare patients, just like Part A. And just like Part A, your medical history or pre-existing conditions do not matter. You're still eligible for it at 65. Some of the disadvantages of that is if you wait to join, you may have a higher premium. With Part B, there is a premium associated with it, and it's around $110 a month. In general, you have to pay a 20% co-insurance for Medicare approved cost, and there is no out-of-pocket maximum for Part B. So if you spend $100,000, you're paying 20% of that, which is $20,000. That's just a rough, easy calculation. And just like Part A, generally the care outside the U.S. is not covered. Now, talk about Part C being kind of its own monster, or own little beast. This is where Part C is a single plan that's offered by private insurance companies like the Humana, like the Coventry, and United Healthcare's. And what they do is they combine coverage for Part A and Part B. And Part D, which is a prescription drug plan, and they kind of combine everything, wrap it up, and make it into one little package. Now, some of the advantages of Part C is that they have the convenience of a single plan, so you're not having to worry about Part A and Part B. It's just one single plan. Many do include a prescription drug plan at no additional cost. And the eligibility for enrollment is not really affected by your health or your financial status, but there are special rules, special rules for in-state enrollment fees. Some of the disadvantages is that in most plans, you receive coverage in a service area. And that's unless it's an emergency. So if you're out of town in Texas or something, and you have an emergency, you can still get coverage under your health care plan. But they try to get you in your service area. Your access to your doctors and hospitals may be restricted, and this is typically like a healthcare plan that you are used to having before Medicare, where different coverages or different plans have different hospitals and different doctors in them. And then, lastly, one of the disadvantages is that the plan premiums and terms can change from year to year. So that's all I got time for today. At a later date, I will go over Part D. But thank you very much and have a good day.